Hey everybody, welcome back. And this is our 9 a.m. lecture with Dr. Len Brancewinz. He is going to be talking to us about the Candida connection and using common sense. And Dr. Len is a pharmacist by trade, an ND-MD. So he has a very impactful story in health and wellness, and he is a great source of information for so many. So thank you for being here, Dr. Len. I'm just going to step back and let you roll.
Okay, sounds good. You know, Tracy, I'm first of all glad to be here again. It's been fun working with you and the whole staff at Nutritional Frontiers. It's reinvigorated me again. And when you asked me to do a talk for this whole series, I picked Candida. You know, it's not the warm and fuzzy. It's not like, oh my God, it's weight loss or one of those. But it gets to be an issue that is, I wish I could say, more common than we even know. You know, most people have heard of Candida. Most people at some point in their lives have had a white overgrowth in their mouth, and maybe from an antibiotic, maybe from a cold or a flu, something like that, where this organism propagated in my mouth, and you may have had to call the doctor and get it treated. But today I want to talk about the prevalence of Candida. And I want to start out by saying this. There are multitudes of practitioners out there that have made Candida the foundation of their practice. They have everyone convinced that everybody has a problem with Candida. Now, let me say this. Everybody, like me, you, have Candida as a normal organism that is present in our gut, in our digestive system. And as I have gone back in time talking about gut health, which is this seminar that we're going to look at, the link to a healthy gut, the first thing that came up was making sure you don't have an overgrowth of Candida. So we all got it, we all have it, but it's only a problem when it becomes an overgrowth. Now, the real problem in the dawn of controversy with vaccines, with coronavirus, with HIV and AIDS, all of these different issues, there is now, and this was new to me just over the last couple months, new highly resistant strains of Candida, Candida aureus, coming around. Hadn't seen that one before. So just like COVID, just like HIV, just like a lot of these other organisms that in the course of time have morphed and changed, just like we're seeing with COVID, this has the tendency to do that also. So first of all, I want to keep an open mind for everybody that this is a normal part of you. We're going to talk about that. I'm going to give you a simple test that you can do. Not the most accurate test, but can at least give you an indication of what might be going on in your system just by a saliva test. We're going to talk about stool testing as we go through this. And we're going to just give Candida some common sense. We're going to say, okay, Candida, we recognize that you're real. You're out there. You're in us. We're going to try to keep you in your place. So just keep an open mind with this. You know, when you hear this, don't go running saying, oh my God, I watched this seminar and I think I've got Candida. Well, you might. And we're going to talk about some of the recurrent symptoms that happens with this. But don't go jumping to conclusions without a diagnostic test. Work with a practitioner, work with somebody from Nutritional Frontiers, somebody that's willing to work with you to help to guide you to use treatments. Now, as I go back in time, and I've known Jamie from Nutritional Frontiers for going on over 30 years now. And if we go back maybe 10 years ago, I gave the little bug in the ear that we needed to do something from a natural standpoint to treat Candida. And everybody at Nutritional Frontiers, the whole staff, the crew, took a lot of intake and said, yeah, it is. It's a little bigger than we actually thought it was. So they came up with a prep called Candy Kill, and we're going to talk about that in a little bit. It's a highly effective prep that can take care of this problem to keep Candida levels where they need to be. Okay, now this is a little bit about me. My main office is in Wilshire Pavilion in Peachtree City, Georgia. Even though right now I'm broadcasting from Tarpon Springs, Florida, where I live. By the way, it's sunny. Come on down. I do a daily podcast on Blog Talk Radio. I also do one on YouTube, and I also do one on Facebook. There's a lot of different links that are right there on our website. Putting out common sense information just about every day. Yesterday, I did a piece, it should still be up on our website, that was on Facebook, on messenger RNA. You know, we heard that term messenger RNA come up with these vaccines. We heard it come up with COVID, that messenger RNA was part of the problem of getting this organism into our bodies. So when the vaccines came out, they were messenger RNA. So the talk yesterday was, does diet play a role in keeping your body's capability of making messenger RNA on its own? First time it came out of Switzerland. It was an article that says probably the most important thing for prevention of COVID. I'm putting the vaccines on the back burner here. The most important thing was a healthy diet of food, F-O-O-D, that came as God put it on the face of the earth. That's what the article said. It said if you're eating a good, healthy diet, your body made enough messenger RNA, and you have a good shield of protection up against things like COVID, or things like Candida, or things like the common cold. Fill in the blanks. So from a nutritionist standpoint, from what Tracy preaches every day, what we talk about every day, from a dietary standpoint, food as God put it on the face of the earth, number one on anything that we talk about today. Okay, so let's just keep that there. This is a little picture of a slide that was presented by doing a swab of somebody's mouth that had thrush. This is what Candida is, so we might as well take a look at it. Candida albicans, those little red dots are the Candida. So when they do a swab of your mouth, they can actually take a look at this. Now, I'm going to give you just a little. This was at one point an old wives' tale that said, could you do a little test at home? You know, and I'm going to throw this out right now. You saw what that looks like. If you really think, and we're putting this out right at the beginning of this talk, if you really think you may have this, sometime in the early evening, 2 or 3 hours after you eat, wash out your mouth, put a clear glass of water by your bed, let it sit there overnight. First thing in the morning, briefly rinse your mouth, swallow, gather some saliva, and spit it into that glass of water. Watch it for the next couple minutes. If you have a Candida overgrowth at all going on in the mouth, we're only talking about in the mouth, you will see little strings start hanging down from your saliva. You'll see cloudy specks in the water and a heavy looking saliva that sinks to the bottom of the glass. Now, is that diagnostic? No. But it's a little thing that you can do, because I've had so many people call and say, look, I just had to have an antibiotic for maybe a middle ear infection or sinusitis or whatever. And you decided to take an antibiotic, and next thing you know, this happened. So that's just a little thing you can do at home before you start yelling that you need to go have this thing treated. Okay, next slide, Trace. Heat makes objects expand. I blame my gut on global warming. I don't know about you, but I'm getting a little tired of hearing about global warming. And this fella here thinks his gut is as a result of global warming. Next slide, please. Today's agenda. We're going to talk about what is Candida. We're going to talk about opening your detox pathways so that your body can get this out of your system. We're going to talk about gut health. Now, the talk here, when I made this slide on how to get off the purple pill, we're going to save that one for another day. Okay, now the reason it was part of this agenda initially was the fact that those that have taken Prilosec, Nexium, Protonix, Prevacid, whatever, for a long period of time, longer than the 3 weeks maximum that it says on the package, tend to have a disrupted gut. And there are links that say if you've been on one of those for a long period of time and the doctor says just keep taking it because we don't want esophageal cancer, whatever, we need to chat about that, because that could be a link. That could be something that's out there that could lead to an overgrowth at some point. And we're going to look at natural approaches. You know, that's the whole principle of this, is that rather than running to allopathic means, and I'll even spell some of those out on a slide, we're going to talk about how you can treat this. And I cautionally use the word treat, but we can support the body's natural approaches to this to get it under control. Okay, next slide, please. This is a long one. Primary and secondary mycotic infection caused by members of the genus Candida. So there's an entire grouping out there called Candida. Fill in the blanks on the other part. We're talking about Candida albicans here. Clinical manifestations may be acute, subacute, or chronic to episodic. So what it says here in this definition that comes from the CDC, this can be something that is just very acute, comes out very strongly for a couple days. It could be something that flies underneath the radar, that you don't even realize it's a really big deal and it just stays lingering in your body for a long period of time. Or it can become chronic, which means your body has been fighting this thing over and over and over again, and it starts to become systemic. Involvement may be localized to the mouth, throat, skin, scalp, and the scalp thing is more common than you know, vagina, fingers, nails, your lungs, your bronchi, the entire gastrointestinal tract. And it may become systemic, which can cause a lot of problems. And you see the word endocarditis there, and meningitis, an infection that can actually literally spread to the brain or to the lining of the heart. Okay, next slide, please. So what is it? There's another blow-up slide of what it is. And there's a little guy there, a little drawing saying, here are some of the things that at a glance could be manifestations. Itchy, burning eyes. Chronic fatigue syndrome. Now, no, wait. You know, as I'm saying this, don't go say, well, I've got both of those. I must have this. Itchy skin rashes on the body. Now, you look where those little arrows are, in the folds of your elbow, shoulders, upper chest. Genital itching, which gets to be a big one even for men, that it can become resident externally, internally. Chronic bloating. You know, so many people have this issue where I eat something and almost immediately it looks like I'm 6 months pregnant. And again, the white-coated tongue, and then again, can be diagnosed. You can see it where you can have chronic constipation or even chronic diarrhea that can result from something like Candida. Next slide, please. I know this, we're going to try, it's 9 o'clock in the morning. I don't know if I want to see this, but again, talk to somebody. If you ever go have your nails done, by the way, I love pedicures, but anyway, if you do get your nails done, ask those women what they see sometimes. I mean, this is another problem that when it becomes systemic, you start to see this kind of issue surface and be very difficult to control. Next slide. Topical. Look at the folds on the fingers. Look at the folds, the redness and the openness of that tissue. And you see it surrounded by a little bit of white in there. The folds in between the fingers and the little bit of white. Again, coming out through the skin. This is going to require, and we'll talk about this, both a topical application of an antifungal. Think of Desitin. You know, if we go back and we think of Desitin that was used for decades for diaper rash. I think it was undolinic acid, which was in that. It works. Can use that topically, but this is going to require also some oral administration as well. Next slide. Candida. Now, here looking down the esophagus, looking in the throat, That one on the left is looking into the throat through the mouth, and you're seeing what a lot of people call thrush, that white overgrowth that seems to be so prevalent. Why is it so prevalent in the mouth? Because that tissue turns over very, very, very rapidly. And that tissue also is very, very prone to what's called biofilm overgrowth, which means the susceptibility. If we do get something in that part of the body, it tends to hide. It tends to stay in the gum linings. It tends to stay in the soft tissue. It tends to stay on the tongue. And then at a point where the immune system has a hard time keeping it in check, it comes out like this. And again, it requires, because this can become life-threatening if it's not treated properly. When you have something like this, it absolutely needs to be treated. Now, in this case, typically from a pharmaceutical perspective, we make up what's called a magic rinse, which has been used for decades, nystatin, a little bit of Benadryl, and something topical to anesthetize the area so that we can actually get rid of this. So this is an issue. If it becomes chronic, it can become very dangerous to the vocal cords, to the tonsils, to the back of the throat. Next slide. Frequency. Now, this is intriguing. The CDC recently classified Candida as a sexually transmitted disease. It is now classified as an STD. It's the most common fungal pathogen worldwide, just in the United States. 10 million doctor visits per year, more common than we think. Listen to this. Affects 75% of females at some point in their lives. 45% reoccurrence rates. Tell me something else. Tell me another disease state. Tell me something that we could have as resident problems that has that great of a reoccurrence rate. Because Candida tends to form biofilms, which means it has a way of protecting itself from our own God-given immune system. Fourth leading cause of nosocomial infections, systemically. Again, I'm not giving this to scare you, but it can become as high as a 48% mortality rate if it does become systemic. It is a significant problem with preemies. My granddaughter, thank God, did not, but when she was born 5 years ago now, she was 6 weeks premature and spent 6 weeks in the NICU unit at West Penn Hospital in Pittsburgh. And the number of cases of this that I saw as I visited there was unbelievable. So again, this is a little more common. And if it was a vaginal birth, even early, it can become resident through the vagina on the vaginal birth to the preemie and can become a systemic problem there as well. Next slide. Meet the hospital staff. Now, this is just a little exaggeration, but I wish I could say it wasn't so true. As I mentioned, there are all kinds of things that go on in today's world in hospitals. We saw it firsthand with COVID. We saw the difficulties with treating COVID in the early days. We saw problems that are still existing today with MRSA and the overgrowth of resistant Staph aureus, strep reinfections. We've seen all of this in the problems that have occurred in the hospital. So what's the takeaway message from this? Employees must wash hands before returning to work. Absolutely. But the problem is we need to, unless absolutely necessary, try to stay out of the hospital. We have to. Next slide, please. Your infection may be antibiotic resistant, but let's see how it responds to intensive litigation. It's believe it or not, I saw a commercial for a lawyer. It was absolutely down here in Florida that says, have you been battling Candida for a long period of time and not been treated correctly? Maybe you need to call me. So now that's another one for the bumper chasers to come after. But anyway, next slide. Concerns. What is the major concern? What is the major problem? Cancer patients with a suppressed immune system. I wish I could say this wasn't so prevalent a problem. But it has to be at least a consideration for anybody that's in the battle for their life. However they're being treated, working on a natural front, working with an oncologist, whatever you are doing to fight that horrible thing called cancer. Understanding with a compromised immune system, this has to be taken into account, because if this does become a resident problem in a cancer patient, it can become terminal. Immunocompromised individuals that have HIV, etc., or someone that's being treated with something like a biologic, Humira, all these new commercials you see on TV for eczema, for irritable bowel syndrome, for Crohn's, all these immune suppressants can become a major problem. Major problem in leukemia, increasing problem with a massive drug resistance to antibiotics and antifungals. What has been used for decades to treat nystatin is now becoming, which was once the gold standard and still is the gold standard in medicine, most of these organisms are now becoming resistant to it. It's been used ad infinitum, and unfortunately, it's going to take a combo approach to actually take care of this kind of a problem. Next slide. Situations caused by Candida, as you saw in those slides, esophagitis. Can you imagine if that becomes resident in your esophagus and how the esophagus would then spasm? And the difficulty, we've already seen patients in hospital visits that have had this, that you try to give them a drink of water and they almost drowned on it because the esophagus spasms shut. Thrush, we saw those slides again of what it looks like in the mouth. Deep tissue candidiasis, we saw it in hands where it becomes an open sore. Genital candidiasis. And, you know, I can't tell you how often that medications were actually developed, one in particular called diflucan, which was a one single pill that was going to go in and solve this problem. And now it's becoming resistant. But these things were passed out like water through the 80s, 90s, and the early 2000s. If you went to the doctor and he wrote you a script for amoxicillin or a Z-Pak and you were female, you got one of these pills to go with it, because the odds ratio of you getting candidiasis was rather high. And cutaneous, that's the fingernail issue, which is, again, I wish I could say more prevalent than we think. And if you do get your nails done, let me just say this again. If you do get your nails done and get those, I don't know what they're called, extensions, the things that are actually put onto your nails, and then they polish and they look great. The odds ratio when you're doing that with the glue, etc., and the trauma that it does to your natural nail beds, your risk factors of getting cutaneous candidiasis is rather high. So pay attention when you remove those. Look at your nail beds and make sure that you're not creating a problem that is going to be something that can go resident. Next slide. So diagnostic, how do you really know if you have this? You saw at the very beginning with those first two slides we showed were microscopic smears. They do a Q-tip of the inside of your mouth or your tongue, and they smear it and they look at it under a microscope. It shows very characteristics of those strings that you see that come out of Candida. You can do a fungal culture. You can actually grow it on agar, as we did if anybody's taken any biology classes. Occasionally they can do a biopsy of a lesion, okay, which is leukoplakia, which is a pre-malignant plaque, which can be started by Candida. And then the most recent, which has now come down in price quite a bit, which is stool parasitology, which means we take a stool sample, fill that little test tube, send it off to a lab, and they run a test looking for, I believe the number right now is 57 potential parasites that can become part of us. So they look for a breakdown of the good, the bad, and parasites. So that can be done using what's called DNA analysis coming out of stool. So again, since 23andMe and some of the newer labs have this whole new technology available, you can actually do this. It's typically, unfortunately, not covered by insurance, not all insurances at least, and it's not inexpensive. You know, to have that whole pattern done, it's probably close to $200 to have a full stool parasitology done. Next slide. Treatment, topical agents. Mycelex troches were one of the biggies. They're actually a prescription drug called Mycelex cream. They make oral rinses for this specifically. Systemic treatment is indicated if the topical agents fail. This is where diflucan and a whole series of other medications are typically used. Candikill. It's here in third place. I would put it to the top of the list. Very important. In analgesics for pain. Now, this says inflam here. X-Flame, one of the great preps from Nutritional Frontiers. Why would you want to do that? Because it's an inflammatory process. So if we have an issue that seems to go systemic, oftentimes adding a nice natural anti-inflammatory like X-Flame, don't have to go super high, maybe 2 capsules 3 times a day while you're treating with Candikill can make a substantial difference in lowering the reoccurrence, but allowing your own God-given immune system to go out there and fight. Those that have oral prostheses tend to harbor or reintroduce infections. Again, that's not everybody, but again, it's something that has to be at least thrown out there. Next slide. Currently approved drugs, nystatin, ketoconazole, Nizoral now, I believe, is available without a prescription now. Sporanox, itraconazole. Now, I got to tell you that when I had my compounding pharmacy back in the day, we used to make itraconazole nail application for that fungus that grows underneath nail beds. Can still be compounded, still can be made. I can help you get to a compounding pharmacy that can do this kind of work. Fluconazole, which is diflucan, clomitrazole, which is Mycelex. But again, those are rather extreme. Sporanox comes with a whole myriad of liver complications. So you got to be very, very careful for the length of time that's been used for treatment. I've seen prescriptions written for this. Sporanox, take it daily for 1 year to treat your nail beds. Again, rather aggressive and really can come with a lot of complications. Next slide. Problems with the drug therapy. Problems with that last slide. They're very difficult in the digestive system. Nausea, vomiting, diarrhea can suppress renal functioning, kidney functioning, bone marrow suppression, cardiovascular, hepatic, liver issues, neurological toxicity. So every one of those drugs come, the reason they require a prescription is that they come with a whole world of difficulties or side effects. And it's got to be thrown out there. You may have to do a treatment with one of those at one point or another. And again, the importance of continuing therapy for the prescribed duration, usually at least 3 weeks, typically 6 to 8 weeks. This is a very resistant organism. You're not going to get rid of it in 2 weeks. When we're using Candikill, for somebody that is systemic, when we look at this, we say, be prepared for a treatment that's going to last at least 8 to 12 weeks to get the full effect and getting the good kill rate. It's extremely important. Now, oftentimes we have to use something to enhance Candikill, which will help dissolve biofilms, and that can be done simultaneously. Next slide. Diet issues. Does diet play a role here? Let's think. Does diet play a role here? When we look at this and say, what foods can help? Low sugar, non-starchy vegetables can actually help to kill off Candida overgrowth. There's actually a book out there by Lisa Richards called The Candida Diet, which, again, in their recommended eating on a daily basis, rutabaga and onions. I don't know where you get rutabaga, but that was in there as part of the cure. You can also go to livestrong.com, and there's a whole list of foods that can help you to take care of Candida. So again, does it play a role? Decrease your refined carbs. That's 62% of the issue. Why? Refined carbs, carbs that have been altered by man, processed foods, will be food for Candida. You know, I sit down and talk to somebody about this and they say, what do you mean I got to give up mac and cheese? What do you mean I have to give up my Cocoa Puffs in the morning? Yeah, it's time to, again, look at that, decrease your sugars. It's time to do this, because if you want to get serious about this, decreasing your sodium intake, decrease dairy, increase your manganese. Now, it's intriguing that manganese, which you don't see a whole lot, I put it together in a prep we call Backflex, because it does help to stop tissue from spasming. So if it is systemic and we got esophageal spasms, a low dose manganese on a regular basis can help prevent that from occurring. And again, just like we did with COVID, these slides I did years ago, but just like with COVID, increase your zinc. Okay, it's depleted oftentimes, and zinc can become a cofactor to support your God-given immune system to be able to go in and do the killing, to keep this thing in check. Because once we do it, once we use an application here, we made the dietary changes, we set upon Candy Kill, we went about trying to get this thing under control. We need your own God-given immune system to step up and now keep it in residency. Next slide, please. Candy Kill. It's a focal point for today. Infections in the gut and supplements to target. Now, you're going to see here 4 specific remedies. 4. Candy Kill is 1. SBC, which is Saccharomyces boulardii cerevisiae, which is a very specific single-strained probiotic that has antifungal capacity. Migragon, it's a tincture that is anti-parasitic. So we're going to go with the thought process that if you have Candida, the potential is there for a secondary or a tertiary infection as well. So if you're going to support and you want to do the kill as effective as possible, Microgon tincture can be added at that point. Now, there's a lymphatic tincture as well. Why? If you've studied natural procedures at all, if you've been watching some of the talks this week, and I'm sure somewhere along the line, you're going to hear a lot of people talk about lymph drainage and how important it was. When we talked about it, when Tracy did a talk, a wonderful talk, a couple of weeks ago on helping the body to fight off COVID on its own, and how important it was to do lymphatic drainage, because the lymph system is responsible for getting the waste material from the kill out of the system. It's just like having the drains open in your sink. If you don't have proper drainage, everything that you're trying to do up top is going to run into a problem. Next slide. Candy Kill ingredients. Now, I apologize, I don't do very good in this, but berberine is topping the list here. And I want to talk about berberine because berberine comes from these various wild plants with yellow roots such as golden seal, Oregon grapefruit, barberry, golden thread. Studies in animals and in humans have demonstrated that berberine exhibits broad spectrum antifungal and antibacterial activity. Berberine. Again, one of the foundational parts of this. And if you see that last little, it's the last little article that's there that says the effect of traditional Chinese medicinal herbs on Candida from patients with HIV and AIDS from 2011, April 23rd. They talked about using berberine, even in something as serious as HIV and AIDS. Next slide, please. Also been shown useful in cases of antifungal resistance. In other words, in the same way that overuse of antibiotics has resulted in antibiotic-resistant strains of bacteria, so there are antifungal resistant cases of Candida. As I said, now the new strain called Candida aureus has surfaced. much more difficult to treat. And it's not usually the first line, but it's now appearing all too often in people, especially with immune suppression. Combining berberine with pharmaceutical antifungals like fluconazole can improve the patient's response to antifungal treatment. Again, another study came out December of 2013 that says if you want to be effective in this and you go for the pharmaceutical, oftentimes that's not enough. So if you use a combination prep like these that we're talking about, you can get the job done much more effectively. Next slide, please. Caprylic acid. You know, this one's been a foundational one. It's a medium-chain fatty acid commonly included in natural antifungal supplements. Studies have shown that caprylic acid inhibits Candida growth. So when we're looking at this, is why would this be put into Candy Kill? Because this organism, this thing that's growing, replicates very rapidly. If you add caprylic acid, it gets taken up as almost like food by the Candida and inhibits it at the DNA level from replication. So as you're going about with all the other ingredients and doing the kill, caprylic acid is getting involved in the rapidly developing organism so that it does not have the capability of propagating. Some studies have shown that caprylic acid inhibits Candida growth. A 2012 Japanese study demonstrated caprylic acid was effective against both mycelial growth and yeast forms of Candida albicans and oral candidiasis. Caprylic acid may have some antibacterial properties as well. Next slide, please. Grapefruit seed extract. Been used to combat Candida and other infections. An in vitro study from Poland showed that grapefruit seed extract exerted potent antifungal activity against various Candida yeast strains. And again, I show you that these are studies that are published. Another ingredient, and this is one that I know a lot of you have probably tried on your own if I've gotten anything mild, is oregano. Really effective. You know, oregano tinctures, really effective, but try to tolerate it. Oregano, if it's going to be therapeutic, in the concentrated strengths, these oregano oils are very, very potent, and most people cannot tolerate them. I know we have a lot that take oregano and keep it on hand. If my kitties start getting a little bit of a cold or a flu, a couple drops on their tongue, they're going to cringe, but it can become antibacterial, a little bit antiviral. Shown to have antifungal actions according to in vitro studies. One study showed the benefits of oregano oil specifically against Candida albicans. That was from an article in Journal of Applied Nutrition way back in 1995. Next slide. Garlic. Been revered for thousands of years as a culinary and medicinal plant. Garlic's mentioned in the Bible, used by ancient physicians such as Hippocrates. Going all the way back, garlic is often included in antimicrobial formulas. Modern research confirms its traditional use in fighting infections. And again, how many of us can just consume raw garlic? If we have thrush, it helps, and it can work if you can tolerate it. Next slide, please. Tea tree extract, derived from the tall evergreen tea tree which thrives in Australia and Asia. The volatile tea tree oil, we've all heard of that, is extracted from the leaves. The Japanese study revealed that tea tree and caprylic acid work synergistically. They work in combination. They recharge each other to inhibit Candida growth. Powerful. Thyme, you know, like the Simon and Garfunkel song. Various studies have examined and verified the antimicrobial effects of thyme extract and thyme essential oils. Now, I know a lot of you use good, well-done essential oils. Thyme is one of those that can be used. Again, the essential oils, not toxic in any which way, can be used in a dosage manner into water or even a mouth rinse to help to take care of the issues with oral thrush. So it can be used. Next slide. Paracleanse is the other product we were talking about. It's black walnut hull. Also contains something called wormwood. Wormwood has been around and again mentioned in the Bible way back in time. Very, very powerful. It has grapeseed extract, olive leaf extract, pau d'arco, black cumin. I heard a lot of people looking for black cumin recently when we talked about the coronavirus thing. Garlic extract. These plant extracts assist the body in eliminating unwanted organisms. Also helps to promote detoxification. Migragon tincture is a liquid preparation, is similar, except it does not have black cumin or grapefruit seed extract, but it has added echinacea and these other in cat's claw bark. So again, the combination preps that could be laid out. And again, my recommendation is we put out these preps, work with a practitioner, verify that you have this kind of problem first, then lay out a systemic treatment. If you've ever had this, let's remember that Saccharomyces, that SBC, should become your probiotic of choice to stay on. Stay on it. You can add 2 probiotics to get the synergistic effect. Use the standardized Nutritional Frontiers probiotic as well as SBC and stay with it. Next slide. Migragon tincture, pau d'arco, black walnut hull, butternut bark, native to the Middle East, now of worldwide distribution. Has affinity for the GI tract and may be used internally or topically. In the pau d'arco, a Latin America herb, used to help both acute and chronic illnesses, including infections, and even been used synergistically in Europe as for cancer fighting. In vitro studies have shown it to be antibacterial, antiviral, and antifungal. Tell me something else that is all 3 of those. That's what pau d'arco can come up. And again, the synergism of putting these together in a tincture, each one accentuates the other. Next slide. Echinacea, well known for assisting the body in recovery from acute infections, activates white blood cells and may increase interferon production. It's put in there as a secondary little boost to your own God-given immune system. Olive leaf extract, useful for fighting infections. Usnea barbata, which is called tree lichen, been used as an antimicrobial, both antibiotic and antifungal. So you see the principles here, putting together a lot of great ingredients together into one entity to get the synergistic effect, to get, I'll call it the greatest bang for your buck. So you want to get this thing resolved as quickly as we can. Next slide. This is, unfortunately, I don't make slides very well. Cat's claw bark, native to South America. This herb has traditional applications, including intestinal complaints, gastric ulcers, dysentery, rheumatism, wound healing. In vitro studies suggest that cat's claw bark stimulates your own God-given immune system functioning. Next slide. Here's SBC. This is what I was talking about. Saccharomyces boulardii, a beneficial gut microorganism to promote good bacterial recolonization in the intestines, especially helpful to prevent and counter antibiotic-associated diarrhea like Clostridium difficile, which is one of those hospital-strained organisms that we find all too often that are now becoming problems when you get out of the hospital with chronic diarrhea. Next slide. Lymphatic tincture. This is the one that has been specifically designed. This kind of a concept's been used for decades, which does help your lymph system, which can become overburdened, which can become, thick, to be able to flow properly so that it can eliminate issues off of your body. You need to use various entities that go and help to thin the lymph system out. Lymph nodes and vessels serve to defend the body against disease and also assist in fluid balance. The tincture contains the following ingredients. And again, you can see gallium, red clover, flowering tops, Stellingia, iris, versicolor, and ginger. Again, together to open up the lymph system. Next slide. Can't really read this, but this is actually, I wanted to put in at least one case study of somebody that presented. This is the results of a study that was done where we did a stool analysis to verify that the organisms were there. So this is just, It didn't show very well, but this is just a printout from the laboratory saying we've got verification that this person did have it. Now, we treated this person for 8 to 12 weeks. Next slide. There's that's called a full GI panel. And you see highlighted in yellow down below with arrows saying, yes, this person was very positive for Candida. We verified it with a full stool analysis, doing a full GI panel. Now, this looked at, you can see the listings there of the various organisms that were being tested for. Next slide. This is where we had resolve. So we went back and rechecked again after 8 to 12 weeks, and we had the resolve that was necessary. So again, documentation that this kind of a therapy works very, very effectively. Next slide. And again, another one, just looking at the full panel that was clean after we had done the verification that this person did recover fine. Next slide. Let's take a break. Screw call, I need coffee. Now I have my coffee. Any questions whatsoever? Tracy, can you get on with me?
I'm back.
There you are. Okay. I'm just curious from your perspective. I know this isn't the kind of thing that we see every day. It is more common than you would believe. It gets to be a real big issue for those that are being treated with antibiotics. And I remember talking to you, and you gave your story about your middle ear problem and how you had to go on an antibiotic for a while, but because you know how to protect yourself, you managed to not have any secondary complications.
Yeah, well.
Can you maintain this for 1 second? I just got to run over to the door. There's somebody at the door. I'll be right back.
I'm going to maintain this for a second. Yeah, so I'll just talk about my story because that's probably easier. So I had to go on, my eardrum burst on a flight home from an event that Len and I were actually at together. And when I got home, he just very gently gave me a little kick in the butt and said, just do an antibiotic for 10 days, try to get that infection out of there. So that's what I did. And it actually did clear it, which was great. The issue that most people get is they use those for long-term chronic treatment, which, that's not what antibiotics were meant to do. And they can have a lot of detrimental effects. So I did offset all of the antibiotic issues with GI Complete, Frontier, Biotics, Superbiotics, and also SBC, which is Saccharomyces boulardii. So if you know how to do the things to offset the damage of something that you might use acutely, it actually works out better. So that was kind of my story. And, Len had asked me about Candida and my thoughts. I think Candida is a good guy in your system. He's always in everybody, and he's meant to protect your bloodstream from different things that can leak from your gut into the blood. So Candida will eat anything that is overgrown. It'll eat anything that's in excess. It'll eat anything in the digestive system that is in abundance, that's not broken down properly. And so he becomes problematic when we don't fix the reason that things are not being broken down, that things are leaking out of the gut. He becomes a problem when he tries to overprotect us from things that we are usually overdoing. So I watch people go through Candida cleanses and Candida diets and all of these things forever, and people are not getting to the root of the issue. And most of the time, it can be, from undigested food, from non-food that we're eating and shouldn't be consuming, things with chemicals and additives and preservatives and all the types of things that our body's trying to protect us from. It can be from low probiotics because we've used numerous antibiotics. It can be from low microbiome, dysbiosis. And it also, heavy metals can be masked by Candida. So my whole opinion, Len, is that, I don't look at Candida as the absolute number one source of the problem. I look at it as, why is it there? Why is it overgrowing? Mm-hmm. What else is out of balance, like your microbiome? Is it masking heavy metals? Do you have a digestive issue, such as a protein digestive issue? So you have so much protein being dumped into your digestive tract that you're not chewing appropriately. You don't have the right enzymatic action for. And so Candida is just munching everything that's in excess, trying to save you. And so people get tortured, I feel like, on Candida diets and cleanses, because they'll do it, and for 4 months they feel great. But what if you didn't fix the enzymatic issue? What if you didn't clear the heavy metals? What if you didn't clear the underlying staph or virus that has been there? What if you didn't clear the underlying infection and all of the stuff that's leaking out? What if we didn't clear the leaky gut? What if we didn't heal and seal the digestive tract? So I watched this repeated Candida cleanse. And so I think one of the things that I've tried to change in my practice is like, all right, let's try the Candida cleanse, right? Let's do that and get you to a place where, you know, Candida is under control. But then we have to figure out the root of why it was there in the first place. What were you doing before you walked in my office to enhance that Candida growth in your body? Was it a poor diet? Was it antibiotic use? Is it underlying heavy metals? You know, do you have leaky gut syndrome? I mean, people with concussions don't realize that Candida is a secondary issue, because if you have leaky brain, you have leaky gut. Once you hit your head, it is absolutely, from studies, you know that you develop leaky gut at the same time. So I think there's a lot of great information for people here to start on a path, right? First, do you have Candida? That's the first thing. And then actually approaching that Candida and getting it under control. And then the second phase is, why was it there in the first place? And how can we prevent it from coming back in such abundance? Because Candida is in our system. It's like H. pylori. We all have H. pylori, right? It's like, it only gets out of balance when we're out of balance, when we're doing things that create an unfriendly haven for good probiotic and microbiome production. So that's kind of how I feel. And I did talk about my antibiotic use and how I offset the overgrowth of Candida after antibiotics and even during antibiotics. You know, you're the one that said, like, hey, get over yourself and take an antibiotic and clear that infection and do the things to offset the damage from it. And I'm like, okay, yeah, good talk. Thanks for the boot in the butt, right? So I did that. And for 10 days, I took lots of different probiotics and GI Complete. And, you know, if I would have felt I needed Candy Kill after that, I would have done that too. But I think, you know, everything should be done in conjunction. It's not that medication is bad or supplements aren't needed. They just need to be positioned properly, taken for the right amount of time, at the right doses, and guided by somebody who can help you. So
I just had someone text me a question saying, you had mentioned that Candida is now classified as an STD. What do you mean? Just so
I know that was interesting.
Okay. In today's world, you know, unfortunately, and it's not an easy subject to talk about, but oral sex can actually transmit this from one person to another. So even for somebody that would have oral thrush, the act of kissing or oral sex can actually transpose that from one person to another. Also had another text message saying, I heard an old remedy called honey can actually help. And you said about cutting back on pure sugars, and I'm sorry, yes, orally I would say that issue using pure fresh honey has been used for vaginal candidiasis externally. It does help a bit. And again, I wouldn't suggest it orally. It's not going to really help there. There's been pros and cons about that because of its sugar content, but using it topically, and if we did have the vaginal issues. One other point somebody asked about was, how about the issues with rectal itching? And you know, one of the more common issues, again, not a really popular thing to talk about, when we do have systemic Candida, there seems to be that chronic itch that just doesn't go away. And it's usually one of the early signs that something is happening internally that needs to be treated. But again, my recommendation is work with somebody.
Right.
You don't want to go out and just battle this on your own. You know, if this is something that just struck a nerve with you, get yourself tested, get yourself talking about with somebody on how you're going to treat this.
Yep. Yeah, so as we bring it to a close, because we only have a minute or so, another question was the rule of thumb with taking supplements with antibiotics. My rule is usually an hour before or 2 hours after.
Exactly.
Taking a probiotic, and every time you take that antibiotic, you're going to follow it with that same protocol of a probiotic, and drinking GI Complete powder mixed with HA Plus powder to rebuild the soft tissue of the gut lining and to protect it, reduce inflammation, and things like that. As for vaginal and anal itching, guys, probiotics can be your best friend. So one of my quick remedies for moms that text me and say, hey, I have this going on, what can I do? Probiotic broken open in a teaspoon of coconut oil, mix it up, put it on a tampon, and insert it into the vagina for 3 hours, and you should be good to go. As for anal, you can, apply just a little bit of that there as well. So there are things that you can do, guys, in the natural world and in the medical world, and it all works together. So,
amen to that.
Dr. Lynn, you're great. Yeah. And sea salt. There was another one. Someone washed with sea salt. Now we got all the remedies. Keep posting them, guys.
Sea salt, for vaginal candidiasis. Wash with sea salt.
Well, it's going to change the pH, right? It'll change the pH and help kill the candida. So it's all about balance, guys. Balance internally, balance externally. But thanks, Dr. Len, for being here. We really appreciate you.
Anytime I'm ordering your T-shirt, so I'll have you all set.
Yay! All right.
Come to Florida.
I'll see you in June. Yeah, I'm going to see you twice that month. All right, buddy. Have a great day. And thank you, everybody, for joining us.
Take care.
Stay tuned. God bless.
Bye.